Hi, this is Dr. Kevin Lambo from NaplesPodiatrist.com, talking to you now about heel pain. Heel pain is one of the most common things that podiatrists see in our practice. So let's get talking about the heel pain. Now, most of the time, people come in and say, "Doc, I have pain in the heel slash heel spur." But the reality, most of the time, the spur is not what's causing the problem. It's a tissue that's attached to the spur. And now I'll illustrate with this foot model right here. We're going to show right here, this foot model has the plantar fascia right here, this little band of tissue. What is a plantar fascia? Plantar fascia is like this rubbery type of tissue on the bottom of the foot, as you can see. This goes from the toes all the way attaches to the heel bone. As you can see, where it's marked red, that's exactly where people typically get inflammation. The heel spur is this little edge right about here. Some people have small, medium, or large. But we found out through MRI technology, most of the time, it's not the spur that's causing the pain. It's the tissue, the plantar fascia, this rubbery tissue that attaches from the toes to the heel. Now, what do we do with this? Now, once we get rid of the inflammation of the plantar fascia, pain goes away. Our typical treatment protocol is we give non-steroidal anti-inflammatories. We give a little injection. I give mine from the side in, get that little anti-inflammatory action with the steroid, or some people go from the bottom up. There's other technology if that doesn't work, or if your heel spur is really large, and sometimes we go in and cut the band of plantar fascia, take a little blade and we cut it in the operating room. We cut the band, as well as while we're there, if you have a sizable spur, we'll grind down the spur. Now, that's not a very common thing that we do. That's only for people who don't respond to conservative treatment. About 90% of patients actually do respond to conservative treatment. Now, physical therapy is also important. As you can see, the Achilles tendon is actually continuous with this thing called a plantar fascia. A lot of times we find that people have a contracted Achilles tendon called equinus deformity. So this Achilles tendon is really tight, so we need to get that stretch with physical therapy. Now, why does stretching help this? Stretching helps this because a lot of times when you get inflammation and pain here, you get a lot of inflammatory tissue. In order to get this tissue to heal, we need to go ahead and stretch this tissue through physical therapy, home stretching exercises, as well as electrical therapy to help stimulate new blood cells in the area. That's why it can take anywhere from 4 weeks to 6 weeks for this plantar fasciitis to go away. Some people get away with just an injection and it goes away in about 2 weeks, but majority of the time it's going to take 4 to 6 weeks of aggressive treatment with physical therapy, injection therapy, non-steroidal anti-inflammatories, and orthotic therapy. Orthotic therapy, what that does is not your doctor's shoulder, your shoe store type of inserts where it just protects the arch. You really need a true orthotic from a podiatrist. Controls the motion of the foot, helps to put all the structure at rest so you don't keep on pulling on this heel spur. Or some people don't have a heel spur and can still have this heel pain right here, but this tissue is pulling on the heel bone itself. The longer this heel plantar fascia pulls on this heel bone, the spur will form or get worse. And that's something called Wolff's Law, where the bone reacts to pressure and pull. So the more pull this pulls, the more non-supportive shoe that you wear, the greater the heel spur will be. So a lot of time when patients come in and the x-ray shows a nice sizable heel spur, I can tell that they have not been wearing good supportive shoes for quite some time. That's not something that forms overnight. Hopefully gave you some good information. Stretching, again, is of utmost importance. And if that doesn't go away, definitely see a podiatrist. Physical therapy, injection therapy, non-steroidal anti-inflammatory is very important. Thank you. This is Dr. Kevin Lamb from NaplesPodiatrist.com.